So we're headed into the final portion of the symposium. So we are very lucky to have Liza Cooper and Katie Darcy with us. And we're going to start off with a collection of videos from patients, expanding on the videos that we've already heard, and then a Q&A with Katie.
Great. Hi, everyone. Thanks for having us this evening. Angie, that was wonderful. I'm going to apply some of those techniques with my picky eater at home who's 6. And so those were great techniques. And I just want to say that something that you said resonated with me about how you have learned so much from your patients and families. And that's really what I wanted to talk about today. We're going to hear from patients and families today in their own words. So I lead child and family education here at Hassenfeld Children's Hospital, and it's an interesting area to lead, and that's because traditionally or historically, education has always been something that clinicians have given to patients and families, right? We are the experts, we are going to give the education, the patients and families are something of students in that. But I believe very differently. I believe that children, young patients, families have vast knowledge that we need to tap into. And as you mentioned, that we need to partner with families to be truly successful. And partnership, like team, is a term that we use here a lot. That we believe that young patients and families can change their outcomes because of how we welcome their knowledge, their concerns, their questions, and that this is ultimately what we need to do. We also partner with families not just at the bedside and in medical visits and throughout their care, but we partner with them in more formal ways. And I'm just curious, how many of you have family advisory councils in your hospitals or organizations? By a show of hands. Okay, so just a couple. So that is something that you, as a dietitian, can actually create. It doesn't have to be big. It doesn't have to be hugely consuming. Even if you had a small advisory group of parents or young patients to advise how you give care where you are, that is something incredibly powerful. These are some of the ways that we partner more formally. So we do have a family advisory council, about 25 parents and some patients who come together and advise us on different initiatives that are being implemented throughout the hospital, everything from nutrition to designing the new children's hospital. We also have employees who are patients and families themselves, and they work on a part-time basis. They sit on different committees. Jackie has someone on her nutrition committee, but we also have safety committees and other committees around quality improvement. And these families provide their perspective, their personal perspective as patients or their personal perspective as parents on how we can improve care or whatever work is the focus of the day. And we also have family faculty where patients and families are our teachers. So they come, they meet with a group of nutritionists or dietitians or nurses or physicians and teach from their experience. And these are incredibly powerful things that you can do where you are. And don't feel that because you are one person or one person hearing this, that you can't actually change your organization in that significant way. You'd be surprised if you brought together 3 parents or 3 young patients, just as a small focus group or advisory group, how many people will be so curious what you learned. And if they could also learn from those families with more specific questions. So I had the pleasure of interviewing several young patients for this symposium, and I'm going to show you that video. And there is something very privileged about that. I know all of you have gotten to know patient and family stories, and that can be hard, as many of you brought up here. It can be rewarding. It can be the reason you do your work. But there's something about talking to patients and families about their experience of care and how we can make it better that's very deep and very different. And so I'm going to play you, these are 2 young teen girls talking about their experience of care around weight management, a very delicate issue. They certainly don't represent every young patient or every family, but I thought their words were quite powerful.
Well, I was already going to see a nutritionist because my mom herself was concerned about, my weight gain, because that's just how she is. But when I heard it from my doctor and got a second opinion on it, and yes, I should see the nutritionist, I didn't feel sad, but I felt like I was doing something wrong just in how I was eating. But it was kind of a wake-up call to me, because I realized, listen, like, you eating this way and you doing all these things that you've been doing for these past years, obviously something is not working out. So the nutritionist will help me tweak it and, help me to change what I'm doing, but still, enjoy what I'm eating. And
when speaking with a physician or dietitian, you should be the dietitian should be straightforward, but to a point not that to hurt, if it's a young patient especially, like to hurt their feelings and make them feel down and such. But at the same time, they have to be aware of the issues they have so they could combat it and not have these issues moving forward. Yeah.
I think it's important for me to see this nutritionist now, because it can really help me to better understand what I'm eating and how to really improve my life and how I live it, and make me happier.
If I were a dietitian or speaking with one, I would probably appreciate it if they would motivate patients into having them get involved in team sports or some other physical activity where they can be around other peers and just enjoying the moment, and not just focusing on the being physically active and exercising, but just enjoying it and having fun so they don't have to worry about it. Yeah.
In a doctor's appointment, I kind of let them take the lead. I don't really say much because, they're my parents and they know what's going on with me, and it's just best to let them do it. But when a doctor asks to see me alone, it gets me nervous because it's like, oh, now I have to explain what's going on with me. But I feel like it's better because I can give my side of what's happening to me, because it is my body and it's my concerns, So I feel like the doctor can really know what's happening by the patient, so by me. I feel like if I have my parent with me, I'll just let them take over, and this whole story is not really getting through.
If I were to be going anywhere, a big party or even a small gathering of friends at a restaurant or any venue, I've always found it's good to eat something before, and not even just a snack, maybe even a decent sized meal before even going, so that way I'm not famished when going to this event and eating everything, and when I don't know what's going to be offered there in the first place. Or if it's at a restaurant, you could look at the restaurant's menu and see if there's anything that you like, and then take it from there.
Weight management is a very sensitive topic, in not just for my family, but for any family or any young lady growing up in today's society. It's something that needs to be approached in a manner, because we don't all fall into the same categories. And unfortunately today, a lot of the influences that are out there are the wrong influences and give young ladies the wrong image for themselves. I think that it doesn't matter what your weight is, as long as you're healthy, as long as you are eating well, healthy, nutrition is very important. A good diet, a good exercise, whether you're playing in team sport or whether you're, just taking a walk around the block after dinner in an evening, and approaching a weight loss conversation with whether they're a teenager, whether they're a young girl, or whether even with it's an older lady or an older woman, it's always a sensitive subject and it needs to be approached delicately. And you also need to understand what's actually happening in someone's life, because a lot of that influences how someone feels and how someone reacts to any conversation. So I really think that when a discussion happens, it should be done with taking many different things into consideration, so that the conversation can flow and can be a productive one.
It's certainly nice to have my mom with me through the steps of my of going to doctor's appointments and making sure everything's okay. Because God forbid something goes wrong, I know she's there, and it's all good. I have someone to lean on in case anything happens. Yeah.
As for me, I'm here for my daughter. I'm here to support her in everything that she does, and to be by her side. And basically, it's her decision. Whatever happens, happens. It's her life, but she knows I'm there for her every step of the way, both myself and her father as well.
I'm just curious if anything stood out from these. Yes.
For these young women who are like, I'll let my mom handle it because she knows me best. And I mean, these are not the families that I know about.
Yes, it's true. Yeah, you're right. They don't represent all families. But I thought it was interesting that Gabby, the first teen, said that if her parents are there, she will have them answer. But if she's alone, that she's very empowered. And I think that was an important message, that it does vary. And as to your point, the family system is really important for some conversations, keep together. But there are certain things that will be shared. And Katie will touch on that too. But thanks for that comment. For sure. This is not a representative of everyone we work with, but any other things that came out of those videos for you that spoke to you that, yes.
I like the fact that Victoria's
Yeah.
mother said that it wasn't important how much someone weighs, it's how they eat healthfully and what kind of physical activity they engage. And I like the fact that that was her, I think, a way of saying, I love you no matter what.
Yeah, there was something very strengths-based in that. I agree. Anything else that came out that touched you or that you'll remember or that stood out? Okay. And I have to say that interviewing them was pretty amazing, and I thought they were pretty eloquent. And yes, I would have loved to interview 100 different patients with different perspectives, but they had some powerful words for us that were unexpected. So I'd like to introduce Katie Darcy, and we're going to pull up chairs up front and really do an interview. Katie is one of our senior family advisors, so she is an employee, a part-time employee of our hospital, and sits on different safety committees and quality initiatives, and does a lot of great work where she shares her voice and experience. And though her experience is different from some of the topics we've touched on today, she has been a patient really for her whole life, and so is really going to share some universal principles about approaching the young patient and some ways that she thinks have been helpful. Hi, Katie. Thanks for being here.
Yes.
So maybe you could tell us a little bit of your story.
Sure. Thank you, Liza, for that.
I think you're good.
Thank you for this lovely introduction. So my name is Katie Darcy, and I was born with a condition called golden heart syndrome, which is a craniofacial condition where my right side is significantly smaller than my left. And I've been treated at the Weiss Department of Plastic Surgery here for the past 20 years. I've had 15 surgeries to correct various imperfections. And as a high school student, I interned at the Weiss Department. And then I was asked by the nurse practitioner to join the Family Advisory Council. And then from the Family Advisory Council that we have here in the hospital, I was asked to become a senior family advisor. And I'm also in my senior year of nursing school at NYU right now.
That's great. So we've talked a little bit today about difficult conversations, sensitive subjects, and you've shared with me the importance of building a relationship with a patient. Can you talk about that?
Yes. From all my experiences at the hospital, I can definitely tell you there's a major difference between the clinician that comes into the room and asks me about what I did this weekend, who are my friends, and warms up the conversation and starts to build that relationship. The clinician that comes in once and tells me lab results or tells me one or two things that I need to do or change, I'm not going to remember it because you didn't make a relationship with me. I'm much more likely to follow the advice that's going to help me if you build a relationship with me.
Oh, powerful. And then in terms of lifestyle changes about things like eating, you talked about, I'd want to be asked about my culture of eating. I love that phrase. Tell us more about that.
Yeah, when I was thinking about the symposium, I was thinking it's not just what I eat, it's who I'm eating with, when I'm eating. Is the issue that we're trying to help me work through, is it going to be what my family's cooking at home? Or is it at the lunch table at school where I have to choose between the garden salad or the burger with fries with my friends? And how to work out those decisions. But unless you have a conversation with me, you won't know which one that you're working with.
Now, when you were 7 years old, you told me that you were asked to change something about what you ate. Can you talk about that?
Yeah, so when I was 7, I had a surgery that was a pharyngeal flap repair. So what that is they reconstructed the entire soft palate in the back of my mouth. So I was on a liquid diet or soft food diet for 8 weeks. So I lived on scrambled eggs, soup, and milkshakes. And so it was okay for those 8 weeks, but it wasn't the only thing going on with me at the time. At that time, I also wasn't allowed to be around kids my age. I had to be separated because I couldn't get strep throat because the surgery would be completely ruined. So it was difficult for me to deal more with my emotional needs with my friends than with my food needs at the time. So I think it's really important to keep in mind like the whole patient and not just the one thing that you're focusing on, because to get like a good idea of what the patient's going through will change how well they can implement the interventions you're trying to give them.
Yeah. And you were asked to give up lollipops. And
Yes. When I was 7, I was asked to give up lollipops for the rest of my life, essentially. They told me that you could always like undo the surgery. They like totally scared me into never eating another lollipop. And that's really hard when you're 7 because you get offered lollipops at minimum once a week at school, at banks, and of course at doctor's offices where I pretty much lived when I was 7. So you guys have gotten better about giving out stickers instead of lollipops, but I always had to say no. And Scare Texas worked on that front, but for many other interventions that medical professionals have tried to give me, they don't work.
Yeah, because you really talked about how that 2 months of isolation was much harder.
Yes.
And that knowing the context for the patient is so important and critical. Now, your parents tended to stay in the room during conversations with any clinician. Tell us about that and what that was like for you.
Yeah, my parents would never leave a room. They were asked once to leave a room when I was 1 year old, and they decided they would never do that again. So no matter what the conversation was, they were not going to leave, which made it really difficult for me to give honest information. So, like, when I was 17, I had already gone to prom, I had graduated high school, and I had also had my first drink. So when doctors or nurses or whoever else asked me, did I drink? I always lied because my parents were in the room. So I think if you can, push to at least have one conversation with the patient without the parents. and because you're much more likely to get the honest information from them.
And you had some powerful suggestions for if the parents are in the room, what should a dietitian do or another healthcare provider? What would be an approach to be able to build that relationship with you?
Yeah, so if you can't get out the parents, I would actually like physically move the room so that way you're like directly facing the patient and it's not like a circle. Because if it's a circle, my parents are going to be jumping in every 3 seconds. I don't know if that's with every person, but that's definitely what would happen in my family. And I would talk to the patient directly and saying, this is the conversation between me and you, and I really need you to be open and honest, and it's really going to be important to your health. And hopefully that will help warm up the conversation and get you to get the information that you're looking for.
And you even said if your parents are asked a question or the question is even asked to the room, to everyone in the room, that you won't answer it unless you're asked directly. Talk about that.
Yeah, so I have a very long, complicated medical history, and normally it's something to do with my medical history or a question about surgery or any question basically. My parents will jump right in with an answer, no matter what it is. And so I just kind of sit there and let them answer unless someone says, Katie, you tell me. And then I will actually give you an answer, and it'll be more than a yes, no, or a nod. And I think those are all the type of answers that you are looking for.
That's great. You even suggested having a conversation first with the child and then...
Yeah, I was talking about interventions then. So if you want me to change something, the conversation that you would have with me is going to be a different conversation that you might have with you, me, and my parents. My parents want a list of rules that they need to change, but I don't necessarily want that. I would rather have a conversation and figure out how I can do this versus, oh, these are the things we're changing and we're changing them now, which is what my parents would do.
And this is so helpful, and I'm just curious if you have anything else you'd like to share for dietitians or other healthcare providers. You talked about with me the importance of doing what your peers do.
Yep. I think the most important thing is to get to know your patients and build that relationship and understand what's important to their lives, who's important in their lives. And because I want to do whatever my friends are doing. So it's hard when you're trying to get me to do something that my friends aren't doing. So having a good understanding of who I am will help develop those interventions. And building a relationship between me and the clinician is extremely important. Because if I don't remember you, I'm never going to remember the information you were trying to tell me.
That's great. And so maybe you could tell us about these pictures, and then we can open it up for questions.
Okay. The top one is my 3rd birthday. The one on your left is my first communion. The bottom one is my entire family at my high school graduation. And this is me on the Great Barrier Reef. Yes.
That's great. Do you have questions for Katie?
Just a comment. I like your emphasis on trying to talk to you as a person. I try to do that and try to get the parents not to, I'll say I'm going to ask, and it's just automatic. They jump in and answer for the child, and I'm kind of funny, so I'm like, no, I want them, and they appreciate that, and they step back and they listen, and there's so much that comes out that they didn't know about their child.
Absolutely.
You know, I mean, they're not, certain things they're not going to tell me, and I know, I don't ask the questions that I know they're not going to be honest about, but just some other things with their friends, and it happens all the time. You know, it's just an automatic answer for my child, especially with your chronic issues and dealing with clinicians your entire life. It's just a habit. Good point.
Is there something you can share with us? Something that helped you make a change that was needed for you? A technique, wise sentence, or can you think of some of the positive things that you've heard that helped you?
Positive change. most of my changes weren't like positive changes, honestly. They were changes about surgery, because my whole life was about surgery. So it's like, oh, you're changing this for a surgery. You're changing this so that way you don't have to do the surgery again. And I mean, those were usually effective, but they didn't last very long.
When you say they didn't last long, what do you mean?
The dietary restriction for surgeries, they're not long for most surgeries that I had. It was like a week. It was 2 weeks. Everyone can change for 2 weeks for something as big as a surgery. But changing for a whole life is a different story and much more challenging.
Interesting. And I just want to address something you had said earlier about the teens in the video, because I wanted to share. I thought this was an important piece. It also touches on what you said about having parents as part of the conversation. Gabby, the woman with the very long hair who was not with her mother at the time, she came to film, and I thought her mother was coming with her because I had set up the interview with her mom. But when she showed up, she came without her mom. Well, it turned out her mom was waiting for her in the waiting room, and I didn't know that, and we sort of went into another room to film. And I think actually this young patient wanted to do the interview without her mom, unbeknownst to me, because I thought, oh, maybe her mom decided, that she didn't need to come. So I think that, that individual conversation, especially maybe with a teen, is very important, because I think she wasn't able to assert herself with her mom. That wasn't communicated clearly to me. I just thought, oh, her mom felt she could do this on her own, so she's here. So just an interesting tidbit. Any other questions for Katie? And then I'm going to do a few take-home messages. Yes?
So I know from a lot of patients that they have highs and lows as far as motivation when it comes to making some type of behavior change. Do you have any advice on how to support a patient as they might run through some of those lows in motivation?
Maybe switch up whatever the intervention was. Like, if that's not working for you, find something else that might work better for you, and it might be less intense than the thing you had originally proposed.
That's great.
Anything
Thank you.
else?
And I just want to share some, final keys to partnership. Certainly, we've all talked about how young patients know so much about their bodies, themselves, their treatment, what works, what doesn't. Parents often know their children best, and so we need to partner with both to be most effective. I also think that beyond partnering at the bedside, in medical visits, we can partner with families in more formal roles as advisors, where we ask them about what has been your experience. Ask them questions like you asked Katie tonight, and they may be patients with the diagnosis you are most interested in learning more. And I think that's key. Recognize, as Katie shared and others shared, recognize that larger context for a child's care and the fear, the worry, the stress that comes with it for the child, for the parent, for the extended family. And once you acknowledge that, as you so beautifully articulated, I think more information and partnership will come. And then use that personal touch. I've had many families share and many young patients share that building that relationship is the key to opening so many doors and to opening motivation as well. So thank you guys. Thank you, Katie, for sharing your story.